Welcome to the Making a Multi-Million-Dollar Med Spa podcast, where we dive into the art and science of building a thriving med spa. I'm your host, Kat Taranto. In this podcast, we're all about empowering medical professionals and entrepreneurs like you with the knowledge, tools, and inspiration needed to elevate your practice to new heights. Whether you're just starting your journey or you're a seasoned expert looking to expand, this is the place where the industry's brightest minds come together to share their secrets to success. So sit back, relax, and get ready to unlock the potential of your med spa with the Making a Multi-Million-Dollar Med Spa podcast. Let's go on this journey together, one success story at a time. Hi, everyone. Welcome back to the Making of a Multi-Med Spa podcast. I am Kat Taranto. I'm so excited to have the one and only Erin Blackwell on with me today. Thank you so much, Erin, for taking the time to come on. I really appreciate it.
Thank you so much for having me. I am so excited to have this conversation with you. It's going to be awesome.
I agree. So a couple weeks ago we spoke and just through, I've known you for years, but we connected again this week, and just the conversation at the end of it, I thought, this is so amazing, your story, what you've accomplished, where you're going with it, that I just thought it's ideal for the listeners of this podcast. So again, thanks for coming on. I just wanted to get started and say, prior to us sitting down and pushing record, I did ask you, what did you get in trouble for as a teenager? And you didn't answer it.
What? What did I get in trouble for as a teenager? Well, there are two really big things, and they both include lies, which from that moment on, I've never lied again, because it hurt me so badly to hurt someone else.
Oh,
and the first one was lying about my report card and changing the grade.
I'm sure you're the only teenager that's ever done that.
The second one was spending the night at boys' houses. Ugh.
Oh my gosh. Well, I snuck out in the middle of the night multiple times.
Oh yeah.
Yep. And I got caught once, and I actually didn't sneak out after that because it was a big catch, and my mom was very disappointed in me.
So my parents have always instilled in me, like, don't get caught, because you're not going to like what happened. Let me tell you, I did not like what happened when I changed my report card grade at all. Now there are rules that I live my life by based on those consequences. And it was such a hard time in life to learn those lessons. I mean, it just actually makes me cringe to think back on that. But it has served me well as an adult and as a growing person. So that's good.
Would you say that you're a rule follower now? Or are you a rule breaker a little bit? I mean, I'm getting the idea that maybe it's the first, but what would you say?
I have a very hard time following the rules.
Oh,
yeah.
Okay.
It takes a lot for me to put my will in to follow a rule perfectly. I like to bend it a little bit and then make it better. And it served me very well, honestly. But I'm sure that if you talk to people that have been in charge of me or things like that, they would be like, yeah, there are some times where we're like, what are you doing?
Oh, I love
but that's
that.
also because I'm creative and I really enjoy seeing what things can do bigger than the manual.
Mm-hmm. Mm-hmm.
And I'm a fan of that.
So why don't you give us a little bit about your background? How did you get in aesthetics? Why did you get in aesthetics? Why did you choose this industry?
So I chose this, and actually this industry chose me, and that's really kind of how my life has gone. I haven't made choices that I'm a very careful person, very careful person. So I just wait and wait and wait for things to fall into line or for big time signs to show up or things like that. And when I was in high school, like I said, I fudged my grades. So I was not a very good student. I had a very hard time in school and I went to college, and it was not something that I enjoyed by any means. And it's hard to even talk about this, honestly. So I will just tell it. But what happened is I worked at the Estee Lauder counter while I was going to college.
I did too.
Yes, I started at prescriptives. I went to Clinique. I went to Estee Lauder. I mean, they just moved me around the floor. I would get in trouble all the time because they don't allow you to sit on the floor. And I was 18, like having a really good time, and I was tired. So I would sit on the floor and get in trouble all the time. Not on the floor, but in the chairs, to get makeup done. And interestingly enough, while I was working there, I met the nanny of a very prominent salon in Atlanta. And she was like, "You have got to come do makeup for us." And I said, "Okay, I'll interview. I'll check it out." So I went and interviewed, and they said, "We really prefer you to have an esthetician's license so you can wax." And I again soaked up all the knowledge from the smartest teachers that were there. And I met a rep with Jan Marini that came into the school, and she hooked me up with a physician who had a luminous, an Alex, a diode. What else did she have? I think she had a 1064 too. This was a long time ago. It like took up the whole room, these lasers. And she taught me everything I know about lasers at that time. And it's just evolved from there. I never got out of the industry. There were times where I thought that it's best to get out of the industry, and then another opportunity would show up. And that is how I mean, it's just served me so well in my life. And I'm so grateful that I was able to find something that maybe wasn't along the beaten path of most people. But it's been this industry has been so good to me. And that's why I'm so passionate about it.
Well, you clearly have given back so much as well. But I have to ask, okay, so you said that you met this Jan Marini rep and just kind of got to know him or her. And I, do you think that the other students that were there did the same thing? Did they connect with the reps and build relationships?
No, they didn't. And what's interesting about what I found is when you're going into your second career, I think there is a misconception of maybe you don't have to do the things you did in your first career, which is network, connect, build relationships, talk to people, get out there. You just think that things might be handed to you in a way because everyone talks about this industry, especially now. I mean, then we didn't have social media and all these things. I mean, I sound old, but we didn't have that way to connect with people. And now it's so much easier. And even now I find that as I go into other, offices and things, the hustle is real no matter what you're doing, whether it's your first career, second career, sixth career. I mean, and Martha Stewart talks about that all the time, right? And I just think that it's important to always connect with people. We are in the business of people. That's what aesthetics is.
I think so many industries are, and that's why I wanted to see, kind of get your point of view on that, because I look at my career and my husband's career and the people around me and the ones that are really successful. And I do think that there's a common thread of whether you're an introvert or extrovert, there is the thread of connection. It's,
yes.
It's putting yourself out there to say hello and see where that conversation can go. And
yes.
At a meeting recently, I was talking to one of the reps, and she was telling me how many people are just mean to her, like literally rude to her walking the door. And I'm thinking, why? I just don't understand that. I think
I understand that sometimes when reps come in, it might not be the best time to sit down and have big, long conversations, but just tell them the truth. Hey, today's really busy. Why don't we book another day? And so that just kind of triggered that recent experience with me, is that, making these connections in life in general, I have found to be so helpful and have really opened up so many doors. And so you learned that obviously early on. I mean, that was at aesthetic school, and look where that got you, into this physician's office, where so many estheticians in aesthetic school are like, how do I get my first job? Where do I go? How do I get there? And it's like, well, in your case, it's just starting with making connections. And I think, that's what I would tell every esthetician. It's like, make connections while you're in school. Start to visit clinic, meet reps.
Oh, I worked the whole time. I mean, I worked for some weird places. I worked for this one spa. I don't even think it's a business anymore. It was called Lord and Lady. Like, I don't even know. They did hair in the front. They had all these cotton tops, they're doing hair. And then I was waxing in the back. And I mean, I did that while I was in school. It didn't last long, because then they asked me to massage people. And I was like, oh no, that's like way out of my scope. I'm sorry. And then I worked for this little Korean lady who was so sweet and would cook for me all the time. And she wanted me one day to run her front desk. And I was like, well, I don't mind doing that, but like, what, how would you compensate me for that? And she just thought that would be part of my job. And I was like, no. So that ended. And then I found Dr. Debbie Dalton, who we are still very close friends, and she's a mentor of mine. She's actually the head of the medical board now in Atlanta, but I worked for her for a year. And then I bounced around after that, because she closed her practice to have another baby. And Aya found me within that next year. And I have stayed at Aya for 21 years this year, which is incredible that I can have a relationship like that with my employer, and they have nurtured my growth. And I'm beyond grateful for them allowing me to not be a total rule follower.
Although you have said you're careful in this conversation about certain things. So maybe it just depends on which part of your life you're talking about, that you follow the rules over here, or you're careful over here.
Yeah. I'm like a big toe in the water, and then I pull it out, and then I kind of put it back in. And so that's how I can get really great results too.
No kidding. Well, yes, no doubt. And not have complications, right?
Correct. So complications are a no-go for me.
What's that?
Complications are a no-go for me. Yeah. No. But they happen. And I think you just have to really understand, your patient, and build that relationship to handhold them through whatever they're going through, and fix it. Because we can fix anything with the tools that we have.
Definitely. Mm-hmm. So when you started with Aya, what was your role?
So my role has stayed the same at Aya. I have been an esthetician there, like I said, for 21 years. When I started, we were 2 locations. I worked in the mall, in our mall here called Phipps Plaza. That was one of the bigger locations. And then the second location was in Atlanta Plastic Surgery, in a room in the doctor's office. So at that time, I stayed at the mall for maybe a year or 2, and then they started having us kind of switch back and forth between the 2 offices, which was amazing, except for at that time we had not, spas were new. So this whole industry was new, and there wasn't an awareness of what's going on and how to get patients. So I actually would get more patients working in the mall, because I could walk around and meet people that work there, and they would send me people, or, I just made a lot of relationships within the mall, and that helped get a lot of patients in the door at that time. We even had a salon below us. So like, we would treat the hairstylists, and then they would talk to their clients about us and send them upstairs to the spa. It was really like the perfect marriage. And now Aya is 9 locations all over the city, and then 1 in Dallas, Texas. So it's grown quite a bit since I've been there. And then in the doctor's office, what we did is we would get patients from the physicians. And at that time, it was a big cosmetic practice. And also they did a lot of reconstruction. So we had a lot of breast cancer patients, and it's kind of evolved since then. And it's a really large practice still to this day. So that's where I started. And now either they've received that treatment as a trade or something at that time. You get the first person that's the head of the tennis team, or whatever group you're going after, the junior league or whatever it is, then you now have a name, right? Everybody's talking about you. I keep saying this, like, I've never been so excited for people to talk about me in my life. It switched in high school, right? Like, I didn't want anyone to mention my name. And now in this industry, I'm like, please talk about me. My name's Erin Blackwell. Like, you know what I mean?
Yeah.
So I think it's exactly what you said. It's pretty basic, right? It's relationship building. It's talking to people, and it's overcoming the fact that any self-confidence issues that you may have, whether you're an introvert or extrovert. I mean, estheticians, nurse practitioners, PAs, even physicians, we're all working in a room with no windows. Mm-hmm. So an introvert can build a relationship just as easy as an extrovert. You don't have to go out in the mall and do things. It takes one person,
Mm-hmm. I love that. So when you started at Aya, what was like your ratio of like facials to laser treatments? What were the main treatments that you were doing then? And then how did that shift and change over time?
So when I started at Aya, we had hair removal, which we did a lot of because people would walk in, of course, through the mall. And that was something that brought a lot of people in. And I think it still does, honestly. And I did a lot of facials, a lot of chemical peels, a lot of selling skincare. And as the years went on, what I realized is my worth and my value to my patients and how they valued the relationship between us, right? They came in basically for therapy and to make their skin look good and to feel good. But what they really wanted was my time as well. So I tried to figure out, how I could be really efficient in the treatment room and do things that I like and get the results that I wanted, not just continually treating new patients, but build those relationships over time and keep those patients in my practice. Of course, I continually treat new patients because you have plenty of time to do that. So it started to change into how can I give these people what they want with the tools that I have? So I'm going to sell everything that I have in my toolbox, right?
We found the perfect trio: virtual, quick, and free. Mint is hosting 1-hour clinical trainings for eCourse subscribers on the first Tuesday of each month at 2:30 p.m. Central Time. We will be covering clinical topics like Sculptra, Genius, BBL, and Hydrofacial. Check out the link below in our show notes to learn more. Our flagship training event is back for another year. Join Mint Aesthetics for our virtual immersion seminar on June 14th, September 6th, or December 6th, or all three, for a day-long comprehensive training on BBL and Halo. We will cover an in-depth didactic with insights on settings, contraindications, post-care, and more. Plus, we will close out the day with hands-on combination treatment demonstrations. For only $5.99, you can get the best BBL Halo training for your entire team. You also have the option to pay with Sciton Success Builder points. Registration is now open for all dates, so book your spot now.
And then it turned into what's giving the best result with the least amount of risk, the most safety, and, how can I be different? How can I be a little bit different each time, right? So it evolved into, all right, I was doing these big chemical peels, which were painful for the patients and a lot of hand holding and downtime, to I wanted to move everything to laser because it was so much easier to handhold people through the process. It was much more, predictable each day, rather than, oh, if this person picked this thing off their face and then they have PIH and then I have to fix that and then I have to calm them down and go through all of these things. Like, how can I get away from that so I can have my own life and sleep at night? And so then I gradually started really moving towards laser. And as the technology changed through these years, it really became so much easier to provide laser only, which is now what I do at Aya. And I've been doing that. I really changed over to that probably, let's see, Carter's 9. So probably like 6 years ago, maybe a little less, maybe 5, but it's been a blessing to me because I can really manage my patients and they're happy. And that's the goal, right? That's the goal. That's what makes me happy.
So what would you say to, because I think one of the things I hear the most working with clinics and teams when, when they hire a new person, let's say they've got a team of estheticians and a new esthetician comes on. Some clinics have this sense of like, maybe it's like a competitiveness, like they're worried that they're going to lose some of their business, which would be pay, to the new person. And so how did you work through that in your mind of, okay, I'm going to shift, I'm going to give up these clients that I've done chemical pills and facials on for all of these years, not give them totally because you're seeing them for lasers,
right.
But how did you make that shift?
So it was very scary, honestly, because I think as a salesperson, because that's essentially what we are, and we're caregivers, is you don't want to give up people, right? And you have this fear that if you give them up once, they're not going to come back to you. And it is really a brain thing because that's not the truth. People love you for who you are and what they get from you in their session, right? And a lot with my patients, I have very close relationships, but I have limitations because there are so many people. And I don't want to provide you with a facial. You don't want me to either, because my heart is not in that, right? My heart is in giving you the best laser service possible, consulting with you and making you a treatment plan to get to your goals. So in doing that, giving up the diamond glows and giving up the laser hair removal, that was quick, right? And good money in the treatment room. It was scary to transition, but I knew this is something that I had to do because I wanted to be the best at it. And experience really does go a long way. I mean, the more you do, the more you know, and you don't even know until you're out of that box and you start talking to people. And so that was my goal. I just wanted to be the best. I wanted to know these lasers and I wanted to know as many different skin types and hard cases as possible. And so I knew the transition, it's hard to get out of your head and be like, oh no, what if, Rosemary likes this person so much better than me because she rubbed her face and I zap her face.
I would like
so everybody's books are booked.
Hurrah. I love that. So true. Like the busier the businesses, the busier the individuals are, the busier the business. I mean, it's just, it all flows together. And I think with our team too, it's this, we all want to work in a great environment. We want to come to work each day and love each other and laugh and have a good time. And if it's so competitive that you feel like people are stealing from each other within the business, I mean, that is just no fun. No fun.
And there has been times where it's been like that, where it's felt like that. But honestly, I think it's a battle within yourself. There used to be a time where I worked with a person who would call the people and be like, hey, why'd you go see so-and-so? And I always thought, you know what? You can't challenge somebody's choice. We all work for the same place, right? And you will find out why someone decided to go to another person. And sometimes that could be a little painful or hurt your feelings, but at the same time, people have their reasons and you just have to go with it. And it is frustrating. I've been there a million times. And it is frustrating, but at the same time, you always have to put that patient first and you can't put them in an awkward position. It's worth your time to say, to let it go and let God.
Take the high road.
Every time.
I agree. I think in the long term, you'll look back and be so grateful that you did, because you build a completely different type of clientele, relationships in your career, that in the moment, it might feel like, oh, that's so wrong. I'm going to do something about it. But really, it's just taking the high road, loving the people around you. I think that's so impactful, Erin. So
it's hard though. It's not the easy road.
No, yeah. And so like talking about building clients, I think you've given so many great pieces already. Looking back to when you were young and, going into the mall and going, whether it was like store by store or going down to the salon and working with the hairstylist. You were working, not waiting for clients to come in, even 21 years or more, you were going out to find clients. And I think that is such a big piece, because as a business owner, we're always doing marketing. We're always driving, the phone. We're always driving to get people in for consultations. But I think, with our team, one thing that we always tell every single person when we hire them is you're part of our marketing team.
Yes.
We're a small business, even though we're a big aesthetic center. In the world of business, we're still a small business. And so I think that, looking at how you've built your clientele over the years, is there anything else that you'd add to that? Anything that you found to be important with communication that you've had with them, whether it's like regular monthly or yearly communication or rebooking consultations, or is there anything else that you would say has been key in what you would tell a young esthetician in building that rapport and getting them to come back?
I think the biggest thing that I teach now in my training company, and when I go to all these practices all over the country, is to listen. That's it. Listen and sit back and take it in, study your person as you're looking at them and just listen. Because when I'm teaching consultation, I find that so many providers are moving so quickly that they're not sitting back and listening. And this doesn't mean you need to offer an hour consultation or 45-minute consultation. That's not what that means. I offer a 15-minute virtual consultation now. I used to offer only 30 minutes. You can get all the information that you need if you are listening. And a lot of people are not. And I realize that that is a skill that is very difficult to learn in your life, in many other areas, not just your career. But as far as being a caregiver, which is what we all are as providers, if you're not listening, you're going to miss something. And that is when you have complications.
And so, and I love that you're bringing us back to the avoid complication, which I've like circled on my paper here. Because somebody that goes outside the rules, and you've said many times already today, you're looking, how can I do it differently? How can I build on this? How can I break the rules without technology? But I'm going to avoid complications at all costs, And sometimes those two worlds are hard to, if you're breaking rules, you tend to slide over on the, moving towards a complication sometimes. And so how do you manage that piece? What are you listening for? What are you picking that helps you to avoid those complications?
So I think it's lifestyle. It's traumas that maybe they're going through. It is their past experiences. My favorite story, and I'm sure you hear this all the time, at aesthetic care in your practice is the patient that comes in and says, I've had microneedling RF here, I've had ultherapy there, I've had a moxie over here, and I have received no results. Right? That's like the big old red flag waving in the air.
I'm like, what are you doing with this person? I'm just waiting for your answer. Like,
so
where do you?
The question is, you're listening to their stories because these are the patients that are frustrated. These are the patients that are willing to do whatever you say because they've done whatever, Susie and Carol and Pam has said. But you're terrified to treat them because they do not have an expectation that has been met. So what is the question? What is your expectation? Right?
Mm-hmm.
She starts pulling her face up. Well, you know what? I can do a lot of things, but I can't do that. But you know who can? Dr. Van Noom. And he does an amazing job.
Yes.
He's an unbelievable surgeon and brilliant and talented. I'm going to send you to him to get a consultation so that you can understand what your options are. But let me tell you how I can help you. Okay. I can make that skin really, really healthy. Because by the way, if you tighten skin that is not healthy, it looks like tight, bad skin, which is kind of strange, right? If you tighten skin that is beautiful and glowing and luminescent, you are going to have the full youthful picture, which is desirable, right? It's about explaining things in a kind way and figuring out what your patients want. Some things you're not going to be able to give them, but most of the time there is something that you can give them.
Oh, absolutely.
Yeah.
Absolutely.
You just have to get them to understand.
This just popped in my mind, kind of a little bit off track, but we'll come back. So talking about tightening with all the technology that you have, and there's a lot of companies that come out and they say, okay, you're going to do these treatments and that you're going to tighten their skin. You're going to do these treatments and you're going to tighten their skin. And we have 40 devices. We have Softwave and microneedling RF, and we have Heroic, and we have Skin Tight. We've done Indiva and Exless. And so I've got lots of these technologies from companies that would say, to expect some tightening. And is there some treatment that you found that you would actually tell a client, like, what would you say that's non-surgical would tighten the skin?
I've tried a lot of different things. I do not have experience with microneedling RF, so I can't speak to that, but we do have ultherapy. And then we're pretty much a Sciton only practice. And I see the most tightening, honestly, from my halo. I get a lot of great results with tightening with halo, but again, it's not a facelift.
Right.
So if you're listening to your patient and they're saying, I want a facelift by pulling their skin back, that's not my halo. And it's about being honest. And, the more basic you can explain something so someone can understand, the better. And you can show them a mirror. It's like, when you get the patient that crinkles up their face and they say, I have this one line, and it's like, okay, well, here's the mirror. When do you make this face that is bothering you? In your magnifying mirror at home, let's throw that away, right?
Yeah.
You're a beautiful individual who has one line that you get when you make this crinkled up face. It's not, let's be realistic, and I think in this industry, you have to be clear and you really have to listen, and you've got to.
How do you explain the difference in tightening between something like halo and facelift?
So my favorite thing is if someone is, doing this, right? They want, that is the key, that's the sign.
So if they're pulling back on their skin, just in case that's maybe they're on Apple Podcasts or Spotify and they can't see us right now. So you're just lifting.
So if they're pulling the skin back, the jawline towards their ear, that is my indication that I would really like them to have a consultation with Dr. Namnu, and then go from there.
Okay, well, let's go back to the consultation and working with your client then with the procedures that you're doing. How do you, because you said that your consultation's 15 minutes, you're doing a virtual consult now, you're listening to them. So in your mind at this point, you're not doing kind of like a planned consultation, or do you have certain questions that you ask? Is there a certain way that you drive the conversation? How do you put together this 15 minutes?
So this 15 minutes, and I would not suggest this for new estheticians. Let me just say that, because I obviously have a lot of experience in communicating with people. And that's also something that I teach in my Enlighten You trainings. And we can get very in depth with this, with skin typing and different things, with hard cases such as melasma, acne, acne scarring, all kinds of things. But in my 15-minute, for someone who's more experienced, what I do is just ask them, tell me a little bit about your skin and kind of what you're looking for. And then I just let it go. And I sit back and listen, and I just listen for those keywords. What are they looking for? Are they looking for healthy skin? A lot of people say that now because we have Instagram. Are they looking for a glow? Are they concerned with their pores? Are they concerned with their texture? Are they concerned with tightening? Like, where are we going, and why have you come to me? Who did you hear from me? Do you know how I operate? Because I don't let anyone dictate anything. They have to follow my rules. They have to use my skincare. Again, they have to follow my rules. But it's true. I mean, I just run a very tight ship, so that way I know I'm not going to have a dermatitis situation, or a situation that is where someone's not happy. And if they're not happy, I want to know why, because I'm going to try to get you there, right? I'm going to try to get you there. And I think my patients would tell you that is, I am relentless on getting to that happy place. The issue is there are a select few that you can't make happy, and those are the people that kind of fall off. But you always have to say, I've done what I can do to this point, and these are some suggestions to go further, but I can maintain what you have. Those are tough ones. Those are tough ones to deal with, but they're not the majority, which is good.
So you mentioned you have a specific protocol or plan to prevent complications. What does that look like when you're talking about something like contact dermatitis?
So dermatitis is a funny thing, right? Because when we're doing different procedures, we are using ablative or non-ablative fractional devices. And complications can happen all the time. A lot of times, you are to blame. So you're going to be to blame, and the laser is going to be to blame every single time. The issue is, it's not the laser or you. The issue is, it's your patient. And how do you get to the bottom of what's happened? Okay. You have to ask so many questions, and you have to do an investigation. With dermatitis, it's typically a topical situation, whether it is a product that you have prescribed for them to use post, which then you must take responsibility and clear that up for them. And you should take responsibility and clear it up for them every time. Let me just say that. Or maybe they felt like they looked really good and the healing wasn't as bad as you thought, or they thought, and they went to TJ Maxx and they tried on a bunch of dusty clothes, or they left because you did not give them the directions that they needed, and they went straight to daycare and picked up their twins and got staph infection. These are all things that happen all the time. And your patient is traumatized from that point on. And you have to rectify that. You have to take care of them. And that is part of your job and your career. And you must take pride in that. You cannot just push them to the side because it's not convenient for you. So it's about asking all of those questions. What have you done? What did you put on? What did, like, where have you been? Who have you been with? Do you have animals? Do you have this? Do you have that? And now I have a full protocol that I write down, which I include with every patient. And I teach you that as well in training, where they have different markers of what to avoid so that it is a very seamless healing process. And it is seamless. If you do all the right things, it's completely seamless.
Mm-hmm. I love that. The yoga mat, it's the gym. It's all the does. There's a lot of things. I think sometimes we are worried about telling them, oh, you've got to avoid so much and change your life. And it's like, well, I mean, there just are some really important things to avoid, and it's only a week.
And that's it, right? Like, we are women. We can do really hard things for a short period of time.
Yeah.
As long as there's an end, they're in.
Yeah, right. And I mean, really, I think, the complications that happen, which I would say dermatitis is probably number one on the list for post halo or ProFrac or, treatments like that, ablative fractional devices. It's probably the number one. And, fortunately, it's also very fixable, but
yes,
it's just so, to your point, so much easier when we can avoid it, which is why I also am I really don't like to add a whole bunch to my post care. It's like, it's not like I'm trying to be cheap with the products I put in there. It's not that at all. It's just that I want effective products that are tested and we know are the least likely to cause dermatitis.
Absolutely. Every single day. And that is always my question, right? Like, when we get new products in or new claims, it's like, all right, I'm going to test this for you and I'm going to give it to a lot of patients. But if I have more than 5 people that get dermatitis, it's a problem.
Mm-hmm.
So
correct.
There's a count. There's a count.
Yeah, we recently did that, and out of 20, we got 4. And even 4, I was like, if it's only out of 20, it's just, 1 too many, honestly. So
some of the ones you really want to work.
What's that?
Some of the ones, like some of the products that you get, you're like so excited about the ingredients or the technology, and you just really, really want them to work. And you like the company or whatever it is, but it's just, ingredients are so important. And I really try to teach my patients that, as well as consumers, when it comes to skincare.
So what do you love for post halo? What does your post care kit look like?
So my favorite post care kit was Straticel. And we used that for quite some time. And then with a moisturizer, so like Revision DEJ Face, I loved. And then I love their True Physical sunscreen. I'm not a fan of a lot of chemicals. So that was what I used for many, many years. We've switched now off of Straticel, and for a period of time we were using the Elta Laser enzyme gel, but it's not very moisturizing for your dry people. So you have to add things to that as well. But what's nice about that is an enzyme, right? Because it's going to help remove mins without your patients doing that on their own. Now I've been using the CMT with Revision, what are they calling it? The cosmetic disruptor.
We have it as well. What do you think of it so far?
I'm loving it. I think that it's very moisturizing, which is nice for my drier people. I like that it's one product. It is reducing the vibration of the heat, which is what causes the anxiety. And my patients are really liking it, but I have had 2 cases of dermatitis. That's it. So, those were people though that had compromised skin to begin with. They were like, had never had a treatment before. So it's, I don't know, you just have to, I'm still on the fence, but I love it so far. I really do. And I like the simplicity.
Yeah, we've been using it more, testing it on our team, friends and family, and we haven't had any dermatitis yet. So
yay.
We'll see. And they're also, I feel like it's making a difference. and calming the skin quicker, reducing the sensation of heat. But we also are big fans of the Velez mask. So we use that product. It just, I can't tell you how many clients are like, oh my God, if you would have had this, a year ago, I would have been back in for Halo earlier. It's like they tell me.
And that is, I love it. I actually did the study for the CMT cream for Dr. Namnoom. And that was interesting. They gave me my first opportunity doing that. That was really fun to do on 10 patients, split face study. And now here we are, fast forward 2 years, that product's been in the market or in the making for 4 years. So it's cool to be a part of it. And I think it's a wonderful company. I love them equally as much as I love Saiton. So those are the two companies I've worked with a lot.
A little bit how CMT works. Sorry, I didn't mean to cut you off there, but how it works, what the ingredients are and how it works.
I can't really tell you what the ingredients are right now, because I don't have it memorized.
I don't either.
And also when you do the study, they don't tell you anything. They send you a box of stuff and they send you a Vizia, and then they send you a binder like this big, and you have to follow the instruction. It was really hard for me to do. I really enjoyed it though. I enjoyed learning, but I wanted it to be so perfect for them. And she was like, no, that's not how studies go. I was like, oh, I really wanted it to be like this perfect thing, but it was interesting. So they don't tell you anything when you get the product. You don't know what ingredients they are. You don't even know what the other product is. So I don't have it memorized to date. But what it does do is it's a neurocosmetic. So what it's actually decreasing the pain receptors. And I don't know the numbers of the pain receptors now, but they do have this information. And it increases the receptors that allow you to feel good if pain is present by a topical ingredient. Can you imagine?
No, but somehow we found that it does make a difference, and we won't tell our client what to expect first. It's more so just apply it and then ask how they're doing.
Right.
And, and it's just been, some aren't like this big decrease in heat, but I would say they will all say, oh, that helped. Thank you.
Yes.
As little as that.
Have you done it on one side of the face so they can distinguish?
I haven't been doing that.
You need to try that, because what I'm finding, and I did it for like the first 2 weeks because I was like, I really want to see, So if you put it on one side of the face after, let's say, a Halo Moxie combination, they're pretty hot, right? After that, that's an intense heat feeling treatment. What the response is, I still feel the heat, but the vibration, the pulsating, your blood pressure move up. That is what is gone. And that is, I love to have the least amount of anxiety in my room. I talk a lot about that in my education process with experience for the patient and all of these different things. The least amount of anxiety you can have in a person, which is very, very hard to do nowadays because there's a lot of stress that's outside of us. That is what you need to be giving your patients, is that best experience with the least amount of worry, the least amount of anxiety. And to have something that takes the actual physical part that causes the anxiety out. It's amazing. It's amazing. So try the one side and see what it's always that the vibration, the pulsing is gone. I'm like, that's so interesting. It's really cool.
It is very cool. It's what they're calling a disruptor, I guess.
I know, I like it.
So what does a typical package look like when you've done your consultation, you've done all the listening, when you look together these packages, and I know that's probably really varies because you're doing custom packages for so many different types of people, but maybe just like a package A type for a younger client and a package B type for, a 56-year-old that's never had anything done. What are your favorite, how do you approach those?
So I love what you said, because I think that's a lot of where people's minds go is based on age. And I think that with age now, it's not like that's not your ticking point anymore, because everybody has different concerns that are pretty complex, whether they're 18 or 56 or 80 or whatever it is. So what my goal is in packaging things together is to get them as fast as possible to the result where their husband, best friend, sister, or mother says, "Oh my gosh, you look amazing. What have you done? Did you cut your hair? Did you lose 10 pounds? They cannot figure it out." When that is accomplished, then your patient can be on maintenance and will maintain and do what you want them to do to maintain going forward. So it's always the package that's going to get them to that result the fastest. So it may be the big treatment, it may be the big stack treatment, and you may have to really, I find being honest and freaking them out is the best way to go, because then there's no surprises. And not everybody consults that way, and I understand, but I've had great success with being completely honest with my patients. And if that is not something they want to sign up for, then there's an option B. There's an option B where you can dip your big toe into the water and you can get a nice glow and healthy skin. And then we'll move into option A when you can commit the time and the energy to what where you want to go.
And so what is the difference between, and again, I get that there's probably a million scenarios, but like the difference between option A and option B?
So option A is the dream result.
And what would be a type of, is it a treatment, multiple treatments? Is it stacking and multiple? Is it one treatment?
I like to do a stacked something to get the most change. And then like a nice BBL, 4 weeks later as the icing on the cake to just make everything look the way that you want it to look.
I love that. And then what's the dipping the toe in?
That's like your, I don't know. A lot of my patients don't have the time to commit, but if you were a newer esthetician and lasers, it would be like your 3 series of BBLs, right? There's no downtime, there's no sandpaper, there's no nothing. Or it would be like your 1 stacked Moxie BBL. Something that's a little less commitment.
I mean, I just, good old fashioned BBL, hero, heroic, wherever you are in your journey with that. You just can't go wrong. I think, especially for those clients that don't have or, want to work that week out in a different part of the year. They don't want to wait to get started. They want to get started. And so I just will always love that BBL system.
Do you BBL your face once a month?
I
Are you
do.
Dr. Patrick Better Jr. trained?
I say that I don't have it on the calendar, which I should do that. But I have so I BBL a lot because I BBL when the flushing and blushing comes back.
Yes.
And so if that typically is somewhere, probably more like 6 weeks. I would say I'm not in there maybe once a month doing it. And I should do the full protocol, but I don't, I'll just kind of adjust the protocol based on how much time I have that I've like jumped in the room to have the treatment. And so I am not the best student with that, but I think overall, if I were to count up the forever young BBLs I've had, it's been a lot.
Yeah.
Which is last week I was panicking that, my birthday's coming up and I'm like, I haven't had any treatments. And so I need my stuff. And so one of our injectors, she's like, okay, come in tomorrow, we'll do it. And this is on Thursday and I'm flying. And so I get on the table and I have a treatment on Thursday and on the table, oh my God, I'm flying tomorrow.
It's 9.
It's 9. And what has that been like trying to manage being a mom and, growing your aesthetic practice at Aya and then building your new business with Enlighten You. How are you managing the time between like career growth and the mom? I mean, so much changes.
So yeah, it's so interesting. And you have a son too, around the same age. So you totally get this. There's a lot involved.
It's the best, but I'm curious kind of how you think about it.
When he was born, he is my main thing, right? Everything I do is for him and for us to have the kind of lifestyle that we want to have, and have freedom and flexibility in living this very short life in the best way possible, right? When he was born, that's when I went down to 30 hours at Aya instead of working, 5 days a week. And I'm just so grateful for Aya for letting me figure all these little things out, right? Because they knew my value, or they know my value, and they've allowed me to evolve through my life, because I basically started there as a teenager. So I've been there my whole life. But when he was born, it was a very big realization to me that I had to make the time count with the amount of people that I treat. And that's when I really started to tighten up and figure out, all right, what are the most efficient ways to get my treatment room to work in the small amount of time that I have. And that's when I really started focusing on laser and growing that business and trying to keep everyone booked. No one leaves my spa without booking their next appointment. And that's really important. It causes a problem later with cancellations, but now that we have Instagram and we can flash on Instagram, I have an opening and it fills in minutes. It works at this point. So Carter is, I just want to be such a good mom. And I think we all do, right? We're all really trying to do our best. And what I realized at that time when he was really little is having that extra day off was amazing. And having, preschool with longer hours was awesome. Well, then it changed when he went to elementary school. And in that time, I did get a divorce. And why my life works so well now is because with Enlighten You and traveling and teaching others since 2020, Carter has weekends every other weekend with his father. So when he is gone, I'm gone. And that's how I can do what I can do at this point in time, right? And it's worked to this point. So there's been just transitions of how do you mold and shape time? And I think as a mother, we don't think we have the right to do this sometimes, but honestly, there's just so many different options I've learned to be able to do this. And it's just about taking that risk and following your heart and keeping the main thing. And for me, that is my family. So Enlighten You has allowed me to really grow that part and be there for him. And also now what's really interesting at 9 is he's thinking about his future, which is funny. And he is like, I think I want to be an entrepreneur and a policeman. And I'm like, okay, how about no to the policeman? But that's just a little terrifying. But yes, you could be an entrepreneur. And then he's come to the Saiton conferences and seen what it's all about. And he wants to go in on a training and assist. He's come to Aya and, greeted patients and kind of handed me ultrasound gel or something like that. And he's into it. He loves it. And to me, that's just building my legacy in this world of like, okay, I want my child to be able to know that he can do anything. He can accomplish anything. He has it within him. And he just needs to be exposed and have those experiences. And I'm just so grateful that I get to do that. And I like doing different things. It's part of my personality. I've realized that brings me joy. So it brings him joy too, which is really cool.
That is so cool. Little Carter handing over the gel. I just him.
Yeah.
That's so fun. I know Jax has come a couple times, but this year there's just been a shift in his sports schedule,
Yes.
So it's like he would prefer to stay home and play in his tournaments and games and things like that. And so I'm respecting booking other types of trips when, it's not over the same weekend that he has stuff going on. But it is so fun for them to come and see what we're doing. Where are we all day? I think
mean, we're in their world. We see what they're doing.
Absolutely.
Right? I just love the idea of why does life have to be compartmentalized? Why does my work have to be separate from his life? Why can't he know what's involved, what I'm doing, I'm around? Saiton is so amazing because they preach this whole Saiton family, and they actually live it to their core, which is not something that I've seen in a lot of different companies that I've been involved with. And I love that they are about that. And that has allowed me to then move Carter into seeing what it's about. With the sports, it's funny, Carter, he plays baseball and his dad coaches the team. And they asked, do you want to do all-stars this summer? And so we told him, because of the way our custody is, you may not be able to go to church camp if you do all-stars, because we still want to have our vacations with you. And our vacations might be a little bit shorter because of this baseball schedule. And he was like, all right, I'll do it next year. He was like, no, I want to go to church camp and I want to travel and I want to do it. Yeah. I'm like, oh, thank you. But I get it. If they choose the sports, that's your life. And then you have to make another adjustment, right?
Well, true. And believe me, Jax is not going to choose sports over our family vacations, like amusement parks and Greece and things like that.
But there are kids who do.
He will choose sports over sitting in a meeting all day long. I almost got it though because of Busch Gardens. But it still didn't work out because it was like one of his big tournaments, or he would have said yes, because there's an amusement park in Tampa. Right. And
well, you got a lot of things to do in Tampa. It's cool. Yeah.
Oh, all he cares about is Busch Gardens.
Oh, really? So he's a roller coaster person.
He is. He researches them. He knows, he'll know the park before we get there, what types, how they were built, the companies that have built them in many cases.
That's amazing.
Can he go? Can he not? It's just so fun to be around kids. It's my favorite thing. He blows my mind. So it's
I know. So sounds like a little researcher already. That's a wonderful, wonderful trait.
Oh, only roller coasters so far, but we'll see.
That's okay. They're pretty interesting. You may be traveling the country hitting all these different historical roller coasters.
True. I've been on more roller coasters with him than I've been in my whole previous life. So
I love it.
Those two. Okay, so thank you so much. I've kept you on here so long today. I really appreciate it. I have one more question though. And so I don't know if you've seen, we do what's called the Mint Minute, where it's just, a minute or two or three sometimes, depending on how long I talk through it. But just like a little tidbit, some sort of trick or pearl or tip that you would give. And for me, it may be something to do with business. It might be a new product I love. It might be a way to switch the adapter on the BBL handpiece. It might be a new... it could be anything within the business or any way you teach or any way you do a treatment or treatments together. Just a fun little thing that you've learned over the years that you're like, wow, that's really cool. I got to share it. So do you have anything for me for the Mint Minute as we finish up today?
I think I've shared a lot of Mint Minutes.
I want to give it at the end, any little tip that you would give an esthetician or
out here in aesthetics, there are a lot of people coming in, and you are important and you are worth it. So please take care of yourself. And if you need anything, I'm here for you. I know that Kathy Taranto is here for you because she's been there for me. And I just want to protect my people.
I love that minute. Build your community, which you have been doing since the moment you stepped into that aesthetic school. You know, it's been kind of a thread that we pulled through this podcast. And so I appreciate you finishing up and pulled it all together in a minute today. You're awesome, Erin. Thank you so much.
You're awesome.
Really appreciate you. And all that you've done for the industry and how you're so willing to share and help other people, you know, I think it's just such a gift that you have. And that connection is a gift that I've been, you know, privy to as well. So I just really want to tell you that I appreciate you. So thank you.
Well, I appreciate you, and thank you for letting me come on your podcast. It's like a dream come true. It's just exciting.
Love it. And so where can our listeners find you?
Yeah, so you guys can find me on Instagram, TikTok, LinkedIn, Facebook. I am enlightenu.e on social, and then I have a website, enlightenu.org, where you can get information on training or really anything that I have to offer on the website. So please reach out, send me emails, send me DMs. I would love to get to know as many people out there as possible and help as many people as possible.
Oh, Erin, thank you so much. Appreciate having you on today. You're amazing.
Thank you. You're amazing.
And so that's it for today's The Making of a Multi-Million-Dollar Med Spa podcast. I'm Kat Taranto, and I'll see you next time.
Yay.
Thanks for tuning in to today's episode of The Making of a Multi-Million-Dollar Med Spa podcast. I'm Kat Taranto, and it's been an absolute joy to be part of your journey. Until next time, let your passion lead the way. See you soon.